Hiyo nyingine hiyo ishaingia ndani ya maji. Mimi nimedungwa ile moja kama kutuliza body.
More than 2 years since the outbreak of COVID-19 in Kenya. And after a short while, the vaccine against the virus arrived in the country. Kenyans called upon to get the vaccine to safeguard their health.
There are measures that we announced last year that we have been relaxing because we understand that not everybody has had the opportunity to be vaccinated. And because we are ready and we have got enough vaccines, we will now go more intensively to vaccinate our people in readiness for whatever else is coming.
And despite the precautions and efforts by the Ministry of Health, many Kenyans boycotted the vaccination, and so far, only 35% of adults have been vaccinated out of the estimated 70%.
Vaccination coverage is now just at the half mark of our target. And when we talk about full vaccination, those who have received 2 or more, 9.5 million adults are fully vaccinated.
Recently, during the political season, the Ministry of Health rolled out a vaccination campaign, considering that the huge gatherings were unavoidable.
The aim was to administer 2 million vaccine doses. It was a mixed result. We were able to get half of the people. We did 1 million doses in 10 days.
However, there are still Kenyans who have vowed not to take the vaccine.
Mimi kwangu niliona haina haja and I'm healthy. I take nakula vinono.
This comes despite efforts to even lower the age limit to safeguard both the old and the young.
Mimi sijadungwa na sitaki kudungwa. Hii mambo ya corona naona kama hakuna. Maana yake vile walikuwa wanasema hata ukishika mahali mtu alikuwa na corona akishika inamshika. Kama nipo watu wangekuwa wameisha wote.
Mimi siwezi kubali nikadungwa sindano kwa sababu sioni corona.
Sindano nimedungwa. Saa hii na ngoja ile moja ya booster. Na hiyo nimedungwa kwa sababu ya serikali kuambiwa kwamba nitunjikinge kwa sababu kuna corona. Lakini mimi sijaiona.
The Ministry of Health is now calling on Kenyans to even take the booster vaccine for further precaution.
And the uptake of the booster doses actually remains low, is below 10%. And to us, this is worrying because if there is any upsurge, the people, as we saw from previous cycles, the ones at most risk of infection, severe disease and death are the elderly.
Equally, the ministry has plans to increase more doses in the country to ensure every Kenyan gets the vaccine easily.
We have scheduled to receive more after October. Of course, we are managing because many vaccines have short shelf life, so we bring when the demand is there. So the challenge of lack of vaccines is no longer a challenge.
Only half of the 70% targeted adults vaccinated in the country, the Ministry of Health is saying that low transmission of COVID-19 is not the end of the pandemic, therefore calling on more Kenyans to increase the uptake of the vaccine. Robbie Omondi, K24, Nairobi.